Hello, Dr. Marucci.
Yes.
How you doing? Adam Hoxa with Empire Surgical.
Adam, nice to meet you.
Pleasure to meet you, sir. We're a distributorship for Johnson & Johnson. We work particularly with their sports medicine division.
Sure.
Mytech, have you ever heard of Mytech?
Yeah. I've used a couple of their anchors in the OR just last week, actually.
Oh, great.
So you're here to talk to me about the new screws or sutures or whatever?
Not quite.
Oh.
Empire Surgical has recently partnered with a PCCA-accredited compounding pharmacy. Yes, that specializes in pain creams, anti-inflammatory creams, customizing these for your patients.
Okay.
You have a minute to talk a little bit about how Fusion could benefit your practice?
If it'll benefit my practice, sure, why not?
Of course. Yes. First things first, are you currently prescribing any kind of topicals?
I am, actually. I'm doing Voltaren gel. They bring me plenty of samples, actually.
Okay.
And I'm also doing Lidoderm patches.
Lidoderm patch. All right, I'm very familiar with these two products. The Lidoderm patch is 5% lidocaine, and the Voltaren gel is 1% diclofenac, treating the inflammation.
That's correct.
And the Lidoderm patch treating the pain.
Okay.
What Fusion has done is they've basically taken these two approaches and fused them. So our topical is a multimodal treatment. You can prescribe one product that will treat your patient's inflammation, pain, it's an antispasmodic and muscle relaxant. So that's how it's a multimodal approach.
That's true.
Yes, and we also provide second-to-none customer care.
Okay.
We make sure that we handle the pre-authorization. We contact the patient to go over how they can, how the application process works with the topical. We also let them know when they're due for their next refill, and we even deliver the medication directly to their door, eliminating the transportation that they might have. I know if you have a patient that just went through a total knee replacement, you don't want them going to a pharmacy to pick up their medication.
No,
so this way we
nice.
Yeah, absolutely.
How much does this cost?
Well, it's covered by most major insurances, most commercial insurances, and for a 240-gram tube, the highest your patient would be looking to pay out of pocket is $40. I mean, compared to Voltaren, that's like less than 2 times the amount.
Which insurances will cover that much?
You're looking at pretty much all commercial insurances. The only ones that might have a little trouble covering the topical would be Aetna and GHI. Those are a little bit difficult to get by, considering all the changes recently that have been made.
Most of my practice is private anyway, so I don't think we should have too much of trouble with that.
Okay, great.
So why don't you just set things up with Betty, and we'll talk next week.
Okay, before I set things up with Betty, and I appreciate you allowing me to make an appointment with Betty, are you prescribing any of your patients with the Voltaren gel right now, or in the week to come?
I have 2 people out there right now I'm going to give Voltaren to when they come in here.
Really? How apropos. Let me just show you this very easy scripting process. Basically,
I use an EMR, so this may not work for me.
Oh, even better. Can I set up an appointment to have one of my tech specialists come in here and implement our formulations into your EMR? This way it's a...
Depends. If it's going to take up time, my office is very busy.
It shouldn't be no more than 20 minutes max. Okay. And this way, after we've manually put in the SIG, what we can do is we can register each one of our formulations into your EMR system. Which EMR system are you using?
I'm using Medent.
Medent. Okay, I'm very familiar with Medent, and we definitely can enter the SIG manually. And once we've done that, the script and go process will be, easier than ever. Not to mention, it's a lot cheaper for your patients out of pocket cost. I mean, than in comparison to the Voltaren, and it's a more multimodal approach, multimodal treatment. So, yeah.
Well, I mean, listen, if you're going to save my office time and my patients' money, I mean, I'd definitely like to give it a shot. Why don't you come back to my office next week? Wednesday's usually good. You can meet with Mike.
Okay.
He'll help you walk you through the EMR. If you can get that set up, I'll consider scripting Fusion. How's that?
Okay, great. That sounds great. In the meantime, considering you have a patient out there right now who is about to use the Voltaren gel, how about we substitute the Voltaren for one of these formulations here, and I'll come back next week, and maybe we can talk a little bit about how that patient's been, recovering
Alright.
with the.
He's got tendonitis and arthritis in the knee.
That's yeah, okay.
Which formula would you recommend?
Okay, let me just show you right here quickly.
There's 6 here. I don't know which one to choose.
Yeah, for tendonitis, in my experience, I've seen physicians go with either formulation number 5 or 6.
Okay.
Yeah, these are the two
I don't
most
know
comprehensive.
if I want ketamine in there. Let's go with number 5.
I understand your concern with the ketamine. It's definitely a very forward medication to be using topically. What we could do is we could go with the 5 for now. The scripting process is very easy. We just take this sticker here. We've already checked number 5. Place it right on your script. I'd give this script to Betty up front. She could staple it to one of our demographic fact sheets. We fax it over to the compounding center, and immediately they will contact the patient, have the medication shipped directly to their door, and then I can follow up with you in about 2 weeks. We can see how that patient is doing with their new treatment, their new topical treatment, and then we can also work on getting our SIG and formulations into your EMR system. How does that sound?
Sounds good.
Okay, great. So I have the permission from you to set up the appointment with Betty for the EMR system, and in the meantime, we'll get this first script for your patient right now.
Yeah, we'll give it a try.
Okay, great, doctor. I'm very excited. I will follow up with you in 2 weeks, and we'll talk about the progress of your patient experiencing that tendonitis.
Great.
Thank you so much.
Thank you.
Take care.
Have a nice day.